Hi, everybody. Thank you for joining us today on Navigating ALS with Children. My name is Cherie Santos, and I'm a nurse with ALS United, Greater New York. And I'm very pleased to have Melinda Cavanaugh here. Dr. Cavanaugh is professor of social work and a licensed clinical social worker with a clinical experience in neurology. Dr. Cavanaugh's clinical care and research focuses on children and youth caregivers, young carers, well-being, mental health, and support interventions in the U.S. and internationally. Her research has informed several books for children and families and evidence-based interventions for young carers, including Y-Care, a multidisciplinary youth caregiving skills and support protocol for young carers in ALS, cancer, Alzheimer's disease, and autism. Dr. Cavanaugh is also president of Global Neuro Y-Care, an international nonprofit focused on developing programs and supports for children, youth, and families in neurological disorders. Thank you so much for joining us.
Hello, thank you so much for the opportunity to speak with you all. I'm going to get my screen going in the most pseudo-efficient way.
Thank you.
It's really, am I there?
Yeah, you're here. And anybody
Okay.
can put questions in the Q&A. Okay, and I'm going to go off screen and let you do your thing.
Thank you, Cherise. Thank you. It was really lovely. Thank you for the invitation. Thank you for the opportunity to talk to ALS United, Greater New York, and such a great time in the world now to be able to share the information that I have based on my research, based on my program, but also based on the work we're doing with Global Neuro Y-Care. So I'm just going to move straight forward into my slides. And please do, if you have any questions, very, very happy to answer any and all questions that come up during the presentation. So first of all, I think it's really, really important to, for all of the parents, for all of the families, for all the grandparents on this call or listening, to just understand that we hear you and that we know that this is a very, very difficult conversation. I can't tell you over the years, as a clinical social worker, as a researcher, working with families in not only ALS, but other really complicated neurological disorders, that this kind of conversation with children and youth is often the most difficult one. It's incredibly difficult because families say they often feel scared or helpless. They feel like they don't really maybe need to say anything. Maybe they just are going to let things fly. They also feel like ALS just shouldn't be discussed. So there's a certain amount of kind of a cone of silence around it. But also, families very frequently, and the reason why we're doing this webinar is that they say they have absolutely no idea what to tell them. So if there's one thing you get out of this next 30 or 35 minutes or so, is that everything you're feeling, all of the feelings I just mentioned, all of the thoughts around should, I shouldn't, what do I say, how do I say it, they are all completely normal, and you are absolutely not alone in that. There are so many, many families like yours that are feeling the exact same thing. Some of them are feeling a little bit, some are feeling every single one of these, some are feeling completely different ones. But I hope that by centering this conversation in the acknowledgement that these are deeply difficult, deeply emotional conversations, that it helps you be able to be open to the conversation that we're going to have in the next 30 or so minutes. So I like to talk about it in terms of the telling, right? What does it mean? What is this telling? And we're talking about a diagnosis of ALS, and it's disclosure. It's disclosure of something that is wrong or off or different or not how things used to be, right? People use lots of different words, and you can use whatever word you want to use. It's also an opportunity to ask for help and wanting to share. And just because these are your children, that does not mean that you can't want to share with them or that you can't ask them for any sort of help in understanding how to go about this conversation. It also gives you the opportunity to become closer to somebody. So, whenever you're telling of something big, a diagnosis, a huge change, it opens the door for closeness. And sometimes people actually think of this telling as really that big of a deal. It's just something that's part of our life. It's something who we are. We can talk about this and then we move forward. And it is always a part of your life and it's who you are now. And often I talk about that in terms of the new normal. Your normal before ALS was over here. Now you have ALS and your new normal is over there. So, what you need to think about is how to tell that change, how to disclose, how to share, how to be open about the difference between the previous new normal and your new normal. And when we think about that with children and youth, it's much more complicated because we're very protective of our children and we're protective of their emotions and we don't want to harm them. But the truth is, these experiences are critical for our families because children absolutely want to know. They often want to know from the person with ALS, and they're already looking stuff up online. So before you go in to have that conversation, think about how you feel about it, right? This idea of the telling, it brings up lots of emotions and lots of questions within yourself. So while the telling might be an absolutely wonderful opportunity to share, it's really important for you to do a little bit of your own work before you have that conversation with your child or your youth. And often it revolves around how you feel. And many families over many years have shared with me the fear, right? The I'm scared. I don't know how I feel. What do I need to know in order to tell my child? And this is a golden opportunity to reach out to your ALS organization, your local ALS organization, to be able to say, can you help me share with my child by giving me maybe some more detail about the disease or about how others have talked about it. We also really know the role of culture, religion, spirituality, and we honor that. And we absolutely honor the role those play in your everyday life, but we also honor the role it plays in deciding to have a very deep and very profound conversation with your child or youth, and recognizing that there might be some cultural differences or nuances, and being willing to talk to someone about that, a spiritual leader, a religious leader. But you also want to think about, like, why am I telling them this? And when it comes to children and youth, the important piece is that they see changes. They see that things are different. And by you stepping out ahead and telling them before they have a chance to look things up online and find things that are perhaps incorrect or might completely freak them out, it's better for you to be able to answer all these questions and know why you're telling them. And that way you can have that conversation. And to honor again all the people on the call who are people either living with ALS or have a family member with ALS, I can't stress enough how important it is to, after webinars like this one, any and all webinars you can listen to, seeking guidance from counselors, ALS organizations, families, friends, as I said, any religious or spiritual leaders. Get the help and support that you need and that you deserve, so that you can walk through this process with as much guidance and information and kind of armament, if you will. And there's really no timeline on this, right? It's your own timeline. I absolutely have heard from so many families that anxiety about how quickly ALS moves. So definitely there's that timeline, but there's no one way to tell a child or youth or to share or disclose. The way to do it is the way that works for you. And by knowing that way that works for you is by seeking out support, by seeking out guidance with different organizations and different friends, religious staff, anybody else who can really give you that guidance. So this is a book that I wrote many years ago based on my research on families and children in ALS. And it's a guide that really helps you kind of walk through how to talk about ALS with your children and youth. And there are sections in here that go by developmental stage and age. And that lets you know, okay, so I have a 5 or 6 or 8-year-old. How is that conversation going to look different than with my 15, 16, 17-year-old? Because it is different. And so in this book, we really spend time giving you some suggestions and giving you some guidance about having that conversation. And this book is also available on Global Neuro Y Care's website, which I do have in a future slide. I like to do what I can to make sure that we situate these kinds of conversations in the voices of the parents themselves. And this is after one of my presentations where a parent sent me an email and basically just thanked me for recognizing that children are involved. And I think this is such a key piece. We do want to do everything we can to protect our children, but they are actively involved. And this other quote, I always giggle a little bit because people, I guess, tend to think that young children and youth just, they aren't going to ask questions. They aren't quite sure what to say. But the truth is that children under 10 ask good questions. And if anyone has a child under the age of 10, you know exactly what I mean. So let's talk about what our research says. So we know that parents do struggle to talk about ALS. So all the things we just talked about, like why it's important, what that telling, how you need to prepare for the telling, who do you need to reach out to, what kind of support do you need to have that telling. But when we've asked parents, what is it that has been a struggle or a barrier? And some of you on the call might resonate with you. But one of the things that parents say is they don't want their children to have to think about it. And parents completely understand that need to protect them, right? That need to keep the bad away from their children, which makes absolute perfect sense. But at the same time, the children are seeing things, they're seeing changes. And by keeping them away, you're not engaging them in the opportunity to understand what some of those changes are and to have them integrate those changes into their own new normal. Often parents say they're too young. And the truth is, definitely there is a too young. It's very hard for a 2 or 3 or even a 4-year-old to kind of really wrap their minds around it. That's why in the book, we talk about it at different ages and stages. And really young children are such concrete thinkers. They see one thing and they think this is the cause, right? That black and white hypothetical, maybe, if, and that doesn't exist. They also think that they caused it. They also think that they were at fault. So while we do want to be thoughtful about the age of the child that you talk to about ALS, you also want to recognize that they might be thinking that they did something to cause ALS in you as their parent. So rather than just saying they're too young, stop and think and go through some of those guidance materials in the book and say, well, maybe there is a way to talk about it with their younger children. The one that's also fairly profound is that I don't know what to say. And this is pretty much throughout all of the interviews that I have done. And that's because parents also really struggle with, who do I reach out to? What do I say? How do I say it? And the key is, again, access as many people, as many resources, as many ALS resources as you possibly can, because that is going to guide you into how do you talk about ALS. I like this slide because it helps parents realize that kids are thinking about it, right? So this is based off of two different data sets in children and youth and ALS. And when asked, what do they know about ALS? We see that there are children who have lots of information. They can give just profound detail. It's a muscle disease. It's a disease of the brain. It shuts down the neurons, that transit neurons that can't move. It gives them, it takes away their ability to move. They're slowly paralyzed, right? They aren't using all of the most high-tech terms, but they get the gist of it. At the same time, we have a lot of youth out there who say things like it's rare for a girl to get it. And these are the examples when the child sees a father with ALS and they have no other information. So their assumption is girls don't get it, guys do, right? Or he can't move. Like that's all there is to it. Well, can he move something? Does it change over time? It starts in the legs. Maybe it doesn't always start in the legs. You have to think about the fact that these are kids who don't have accurate or complete information. And that is a really wonderful opportunity and sweet spot for the parents, the people with ALS, the family members with ALS, to be able to talk about really what is going on. And when we ask youth about what they want to say, what they want to know, this is just one quote from many, 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 many that says that they like that level of good communication, right? They think having good conversations helps a lot. They want to talk about it. Now, yes, this is an 18-year-old who is older and has much more complex thinking and has probably spent a little more time trying to understand it. But the truth is, even younger children say the same kind of thing. So if I say it once, I say it many, many times. The conversation is so critical. It's so, so critical to be able to have some sort of conversation. And this is where parents say, all right, fine, have the conversation, but how do I do it? And I will say that from my professional perspective, the best thing to do is simply start the conversation. Do not go into it expecting it to be the most profound conversation. Do it at times when you're already doing things as a family. You're watching TV or you're eating dinner, simply opening the door to, things are changing with me. You notice that my hand doesn't work quite the same way it did. Do you have any questions about that? And that might be an opportunity for them to say, well, yeah, I was going to ask, but I wasn't sure. You hadn't said anything, so I didn't know what I could ask. And that's where you get to be really honest with them. You get to be honest and sometimes say, yeah, it makes me uncomfortable too. And I wasn't sure how to talk about it. And when you're honest and you provide basic information and you've sought out some experts to make sure the detail you give about ALS is correct, that is incredibly helpful because it lessens the stress and anxiety that the child is feeling about them possibly wanting to ask you, but they weren't sure if they could or if they should. And if you start the conversation in a very normal setting, when you're already doing something fine, simple, normal as a family, then they know that it's okay to talk about it as opposed to sitting down and having the big talk, because then that puts the onus and the pressure on the big conversation. And by also starting the conversation in a very normal way, you're just opening the door. It's okay. We're going to watch TV and I'm going to say, hey, can you pass the remote or something? Because, it's hard for me to use my hand at this point. Whatever it is, right? I'm making up scenarios, but whatever those scenarios are, think about it in a very normal way so that your child or you feels comfortable bringing it up in everyday times. When they think about something, they want to be able to ask you a question. They know they can. What if my child doesn't want to talk about ALS? Now, this is quite common. And we know that many, many times, depending on the age of the child, right? And this is often kind of our teenagers, right? Some 12 to 15-ish, they're trying to figure out who they are. They're trying to figure out how they fit in their world, how they fit with their peers. They're forming their identity, they're forming their connections to peers. And it's oftentimes a really awkward time. So if your child expresses to you, like, you know what, I don't want to talk about it. I don't want to talk about it. I'm not going to ask questions. Or if they just don't talk about it and just don't ask questions, what is incredibly important and really helpful is to continue to let them know that you are open to talking about it and provide little nuggets of honesty about how you feel in that, if things are changing, sometimes you feel uncomfortable, sometimes you feel frustrated, sometimes you feel sad, and giving them these little nuggets of it's okay when they feel ready, because they know you're also feeling a certain way about ALS. And they don't have to talk all the time. They don't have to talk, when you're ready. They need to talk when they're ready. But constantly reminding them that it is important that they know that you are open when it's ready for them. When they feel comfortable having it, you have reminded them many times that you are there, but also that there might be somebody else that they want to talk to. And sometimes kids form really wonderful bonds with their teacher, their school social worker, their gym teacher, their coach, right? Their youth pastor, whoever it might be, making sure that they know that they can talk to that person and that you have gone to that person and said, look, this is what's going on. I have ALS. Here's the guide. You can hand them the guide so that they have information, so that if the child does feel comfortable breaching a question to them, that person is prepared. And all of this that I've just talked about is really predicated on the requirement for conversation and the requirement for being open about that conversation. And if you are feeling reluctant, and if you are feeling like you don't want to talk about it, then be very aware of the fact that that is often modeling to your child that they can't ask you either. And if you are feeling that reluctance and that lack of interest or ability to have the conversation, then the biggest thing I can encourage you is to go all the way back to slide one, which is seek help, seek someone to talk to, work through that, because you deserve it. Absolutely deserve it. Which is the point here. What if they ask you a question that I'm not prepared to answer? And often these are the questions that have to do with end of life, right? These are the questions that kids ask about, are you going to die from ALS? How do you feel about that? What does death feel like or mean to you? And that is massive. And I am absolutely not wanting to gloss over this conversation. It is a profound one, and it's profound for you, but it's profound for your children. And so if there's something that they're asking that you're not prepared, or you're afraid that they're going to ask you something that you are not prepared to answer, think about how you would like to talk about it. Like, what would make you comfortable? So if your child wanted to talk about death or dying, or the dying process, how do you feel about it? Sit with it. Ask yourself that. Go to that trusted source. Talk about what that may or may not feel like, because at some point it's going to come up, and you showing a willingness to discuss it shows that child that they have the right, and that they have the comfort, and they have the open door with you to discuss it. And it's okay to answer something that you don't know. We don't always know what's going to happen, right? We don't know what the next day is going to be like. So, not being afraid to say that and answering honestly and saying, you know what, we're going to go and we're going to find out about this as we go along, right? And we're going to be prepared. We're going to get as many resources as we can. We're going to talk to the ALS organization in my community. We're going to talk to religious community. We're going to talk to counselors, school staff, whomever it is, right? So if you're not prepared to have an answer, think about how you feel about it and what would make you comfortable. Ask yourself the awkward, difficult question. And how would you respond if someone asked you that question? Be willing to have that conversation with your child, and sometimes showing yourself, like, this thing has changed and I feel really uncomfortable about it. What do you think? How would you feel if, this happened to you? Do you want to talk about what those feelings might be? And they might say, yes, absolutely. Or they might say, nope, goodbye, I'm going to go close my door. You've still opened the door of conversation with them to where you started it and they know they can come back at another point. So be thinking about how those conversations might go if you're not initially prepared, and how you can prepare yourself. I broached this really briefly earlier, but I think it's probably the most response and sometimes pushback I get from families. And I absolutely respect that and I honor that from families, because families are it is important to them to protect their child. And that is who you are as a parent. That is who you are as a human. You never want to cause your child any sort of pain, right? And so this is a completely understandable conversation. So I'm just going to give a little bit of context and maybe some feedback and some suggestions. So when parents say that they're protecting their child by not telling them about ALS, I like to push back and say, think about what it is you're protecting them from. Is it because you don't know what to say? Right? So that, go back to one of the earlier slides. That's where you talk to a trusted source or a counselor to make sure that your feelings are being attended to, right? So that you're not protecting them simply because you don't know what to say. So it kind of feels like you're protecting them, or it just kind of feels like you're just not having the conversation, or you're not sure what it feels like, right? Get the support, the information, the education you deserve, right? I can't say that enough. You deserve to have all the support and information and education possible about this disease. But maybe your child won't handle it well, and this is where you as the parent are the expert. So who can you engage to help, right? This is where you think about, maybe your child is very close to their coach or the school social worker. Engage people who know your child also, not just people who can help with the conversation in general, but people who also know your child. What are their thoughts about having this conversation? But then there's the families that say, I just don't want my child to know. And in one of the studies I did a number of years ago, we initially were not getting many people to participate because they said, yes, I have a child. Yes, they do caregiving. Yes, ALS is in my family. And no, you may not talk to them. And when we went back and asked and said, we'd really love to talk to your children, but we want to be respectful. Would you mind telling us why you don't want us to talk to your children? And they would say, well, I just don't want them to know. And upon more probing, we'd say, well, do they know anything? And the parents would say, well, they might know a little bit. I mean, I guess they can go online, but, I just don't want them to worry. I don't want them to know anything. In future research projects, in asking children about when and how they heard about ALS, there were far too many children who said, I felt like my parents didn't trust me. I felt like my parents didn't care about me needing to know information because they didn't tell me anything. And I caution parents, I really, really caution parents here from a clinical and a research perspective, right? So I have both my hats on now. Fostering, not telling can foster resentment, can create isolation and barriers in families, and can make children feel unimportant. This does not mean you have to tell every single possible thing at one moment. It means that you need to have that door open for conversation. And that allows them to feel like they are part of it. And your child might not be a talker and might not ask questions. Your child might want to ask questions 10 times a day. Whatever it is, don't shut the door. Don't not want them to know anything. Even though I know in your heart you're trying to protect them, give them something where they feel a part of that conversation and they feel heard. It is extraordinarily important for children today to be heard. So think about that as you think about how we talk about ALS and the potential of protecting them in this conversation. I've spoken a lot about school personnel. We have a book called At School. It's a guide for supporting students who've been affected by ALS. It is freely available on our Global Neuro Y Care website. You can download it, and it is really, really important. It was written from the perspective of the research. So all the research I've done, but it was written for school staff to understand when you have a student who's acting out in class, falling asleep, going to school late, being disruptive, not doing their homework, what's going on there? And it gives guidance for the school staff of all staff variety to ask, what might be happening at home? And if the staff knows that there is an ALS diagnosis, or perhaps ALS has progressed over the summer and things are changed dramatically into the fall, it gives the tools to the school staff and the school personnel to be able to talk to the children, what resources to reach out to, how to engage the family. It's a really wonderful tool, again, for all school staff. And those of you who are in an organization level, in the ALS United level, please don't hesitate to use this material. Again, it's available on the Global Neuro Y Care website, and we create it to be, download it, look at it online. We really, really want this to be able to be used for school staff to support our children in the school environment. Briefly, for our organizations and health professionals who might be on the call, making sure that when you're having conversations with parents, that you think about how to engage the children and the families as a whole, using some of the principles from my earlier parts of this presentation. And when you're able to do that, when you're talking with the families and asking about the children and what can you do to help support them, that's really building that trust in the community, right? And oftentimes what I hear is, well, we know, person X, we know they have children, but we've never met them because they don't bring them to clinic. Well, that makes perfect sense. Most families don't bring their children to clinic, but they have a child. So how can you talk to them using some of the principles from this presentation to encourage them to talk to their children, to be that support person for them, to answer some of those direct questions they have about ALS, and encourage them that it's okay to talk about ALS, even if you've never seen the child, even if the child never comes to clinic or never comes to the office. They exist, they're out there somewhere. So thinking about how the principles that we talked about directly to parents, how you can use them as a health professional or an organization. And for everybody on the call, just to reiterate, excuse me, that there are lots of ways to get support. Our schools obviously are very, very primary. Kids are there most of the day throughout the school year. We also have community organizations. They're your religious, spiritual home. reaching out to as many people as possible and sharing the school book, sharing the book about how to talk about ALS. We've had that shared with lots of community organizations who have said, wow, it's really helped us think about how we engage these children who are in our aftercare program, right? So it's not just that it's about, ooh, the parent has to talk about ALS. It's what other adults are in that child's life who might benefit from these resources. And so I'm going to go into specific resources. Partially, I've talked about some of them, but this is our organization, Global Neuro Y Care. We are an international organization, but our goal is to engage and develop education, create support programs for children and youth across neurological disorders. That's our website, so I'll talk about that just a little bit more. The reason why we created Global Neuro Y Care is I've been doing this work for a very long time. I was a clinical social worker for many years in neurology and met so many families in the home who weren't sure how to talk about the disease. The children and youth were helping to take care of the person with the disease, and there really wasn't any support or conversation or education about it. And so, as I went back into academia to become a researcher, that is my sweet spot, right? That's what I do, is really do research, create programs, develop support to help families not only have a conversation like we're talking about here, but also really engage other organizations to create support programs. And one of the things that, I've just been incredibly grateful to do is work with different organizations around the world to not just engage them and say, hey, what do you need? What are you doing? But take what we have already done in the US and translate it to different languages and different cultures. And the great thing is that a lot of the things that are translated for other countries are absolutely applicable here in the US. And that includes the books that we have translated to Spanish and French, all of our programs. These are some of the partners that we work with, just a few of them. We firmly believe at the foundation that we can't do this alone, and we have no interest in doing it alone, that it is all about collaboration, which is one of the reasons I was so thrilled when ALS United Greater New York asked me to give this talk. I love doing these talks. And maybe someone on the call has heard me give a similar talk before. I do quite a few of them, and I am thrilled to do them. And I'll keep doing them for as long as it takes to make sure that families get the information and get the encouragement and get the support. And one of the things that is the cornerstone of the work we do at Global Neuro Y Care is the Y Care program. And Y Care is a small peer engaged program where children and youth come and spend about 2/3 of a day on a Saturday, and they learn hands-on skill and education about ALS. And this was created with my colleagues at the ALS Wisconsin chapter and with the Medical College of Wisconsin, where we really got together and said, how do we address what we're seeing in the research? So all of my research was highlighting that children and youth are participating in care, but no one is telling them how to do it. They also don't know enough about the disease itself, and they don't have really any peers. They can't really go to school and talk to their fellow 10 and 12-year-olds about the things they did to help their mom last night. So what is incredibly important about the Y Care program is that it's done with peers. It is done by trained healthcare professionals, and the youth receive hands-on support. So they get to learn who all these healthcare professionals are. They get to meet new kids that then they develop long-standing, solid friendships with, and they feel more confident in the skills that they're doing. And one of the things we know is that when they're able to do it in these small groups, that's where the real conversations happen, right? That's when they're sitting around a table talking about different food textures and Does your mom swallow weird? Like, did she choke on things? What does she need it thick? Does she need it thin? What's going on there? And so the speech language therapist and the speech language pathologist and the occupational therapist and the dietitians are talking with them about like different textures. They can try things out. They can see what it's like to eat a different texture type of food. And then they get to talk about it amongst themselves with peers and say, hey, does your mom do that? Well, what about my dad? He does this. And before you know it, they have built peer support in the context of this program. All of the Y Care programs come with handbooks. So you'll see that we've done it in ALS, we've done it with siblings as caregivers, we've done it in Alzheimer's disease. We've also translated everything through the MND Association of South Africa. It's now available in 4 languages in South Africa. And kids can walk away with an actual handbook. And it's interesting. I had a meeting earlier today, and people were saying, do people still like things in print? Yes, they do. Children definitely still like things in print. So, so everyone who attends one of the Y Care training programs gets a handbook so that they can write notes in it that's full of pictures. It guides, it walks them through everything. So it's absolutely an opportunity for them. And I do not want to miss out for all of the healthcare providers on the call. You all are extraordinary, and the Y Care program exists because we have trained over 100 healthcare professionals, PT, OT, speech, social work, respiratory, neurology. People on this screen, there are people in the upper left-hand corner, they're South African colleagues, my wonderful colleagues in Alzheimer's Association, my colleagues here in Colorado and Massachusetts, and down at the bottom in Seattle, have all gone through the training in Y Care, and they're the ones that work one-on-one with the children and youth and deliver the Y Care program. And it's absolutely extraordinary. It's so much fun. The kids have a ton of fun. It is not very serious, for sure. It's absolutely a fun, wonderful day. And just to, again, bring back some quotes that the parents see that there's a difference when their children go to the Y Care program. They see their children have more confidence, asking more questions, and feeling like they're having more positivity and they're more engaged in that process because they got support. They got support, they got peer support, and they got professional support. And those are so, so, so critical. I mentioned some of these earlier. All of these books are available on Global Neuro Y Care. This is a graphic novel that I wrote several years ago using all actual quotes from children and youth in my research that helps them walk through, like, what is ALS? Oh, is this good? Is this bad? Who gets it? The book has the deep conversation, and it talks about how kids feel about having a parent with ALS, what it feels like when that parent dies. So, full disclosure, we do not shy away from the reality that death and dying is part of that ALS process at some point. And so all of the books do address grief and loss. And that is so, so critical. We often don't want to have those conversations with our children, and which is understandable, but they are so important because when that time comes, the children have often had what we call anticipatory grief. They have seen the changes. They have seen the loss of this and the loss of the voice and the loss of the playing soccer and the loss of driving the car. And each one of those losses, they grieve, and they are anticipating that eventual final loss. But all of these little griefs along the way, all of these little losses along the way really mount. And so the book addresses those. All of the books addresses those. And they're all available on Global Neuro Y Care. The last thing I'll talk about, I'm very excited about, is one of our huge cornerstone projects at Global Neuro Y Care, which is the animated film, Lukey and the Lights. So it is a film about a robot. He's up there in the corner. He is full of lights and he gets ALS. And as ALS progresses, the lights go out. And we have created not only the coloring and activity book that you see here, we have a full suite of educational materials for families to help them walk through questions that come up after their child watches this film. We have a suite of materials for organizations like ALS United Greater New York, like any other ALS organization. Here's the questions that might come up, how to help families walk through it. It's an animated short film. It's about 10 minutes long. And I know the next question will be, when is it going to be available? It will be available by the end of June. We're working on a rollout, but please stay tuned to our website, which I didn't put on this slide. I put on that slide. So please definitely check Global Neuro Y Care. That's where you can get copies of all of the books that I've talked about. You can get copies of, or you can get information on the Y Care program. You can always email me. I'm happy to talk about any of that. You can get information on Lukey and the Lights. We have other new programs coming online very quickly for healthcare providers. So all of it is about how to talk to children and family, how to support families, and how to support people living with ALS so that they know that they can do these kinds of conversations, and that there's support, there's information, and there's education out there to help you as a family have that conversation. So I'm going to stop talking now. I do believe we have time built in for conversation or for questions. So I'm very, very happy to answer any and all questions that might come up. I don't see them on my screen, but yes.
Yeah, thank you. And I have given out the books often, and oh
Yay!
yeah, a lot. I give your books out a lot. So
Wonderful.
yeah.
Oh, that makes me so happy. Yay.
Yes. And thank you for those. There is, let's see, let me go to this question.
I wonder if I stop sharing, if I will be able to see. Oh, I probably
No,
might.
you won't be
Okay.
able to see them.
Oh, okay.
Okay, so among some of my struggles with ALS include misplaced anger at times that
Mm,
is witnessed by my 12-year-old and 9-year-old daughter. My 12-year-old especially adopts a similar behavior when she's frustrated, and I'd like some strategies for explaining to her that modeling my behavior is bad, and talk to her about what her behavior without being hypocritical.
Oh gosh, that's a really, really good one. I don't mean a good one. I mean a really important question. Well, the first thing I would say is immediately talk to both of your children about what that anger was. You said it was misplaced, so letting them know that it actually was misplaced. That something about having ALS and the ALS itself creates a frustration and this opportunity for you to misplace or misdirect your anger, and that you see that, and that you would like to talk to them about that, and how do they feel when that happens, and that you recognize that it's not okay, and that they need to be able to recognize that that 12-year-old, if she's starting to model that behavior, that that's also not okay. And this is an absolutely perfect opportunity to not only have that conversation, being honest and open, and how you feel about it, and being honest that you don't feel good about having that misplaced anger, and that you're going to get help for everybody. This is where reaching out to your local ALS organization, your school, your church, finding someone who can be that mediator and kind of conversation starter for your family to help everybody have that conversation around what misplaced anger is, and being able to see it and name it. Say, that's misplaced anger. That wasn't at you. I'm sorry, 9-year-old. This was me thinking of something last week and I took it out on you, or I'm really angry because I have ALS. And sometimes just being able to say that is profound, and letting your children know that that's really profound for you as well. So saying it, naming it, talking to them about it, and finding support in continuing the conversation, but not letting it go and just say, oh, it's ALS, and walk on, but have the conversation with them about it. When it happens, point it out, and let them know you feel regret for that, and you feel sorry, and talk about it. Yes. It's very common. I want to respect the fact that that is something that definitely happens, and you are not alone in that. Absolutely.
Thank you for that. In your experience, are school staff cooperative with helping children cope during the day, etc.?
You know what? In my experience, they are when they have the information. In my experience, I appreciate that you started it with that because I want to be really careful and thoughtful about that, right? In my experience, when they don't know, when they don't know, they will go to this assumption. And oftentimes, this assumption is the kid's just being bad, they're acting out, they're kind of being difficult. When they know, when they have the information and the tools, it makes a world of difference. So taking that at school book and going to the school counselor and going to your children's teacher and say, this is what's happening at home. So if, Bobby's late for school, this is why. If Bobby's falling asleep in class, it's because he had to help me in the middle of the night. Making sure that they're armed with that information, because it's no fault of theirs, but there's a lot of assumptions that happens when kids are acting out or acting differently in school. What we have created is that opportunity for you to give them that information, and they are very responsive once they have that, and they have a guide to be able to help them think about how they can help your child.
Great, thank you.
Mhm.
Does your organization have a list of recommended therapist groups for children per state by any chance?
Oh, I wish. I wish. And that's actually one thing that um, is absolutely at the top of our recognition and kind of like moving forward with next steps. I've been working with Mental Health America and the ALS Association in Alabama, trying to figure out how we can train mental health providers across the country. No, not ALS specific, just mental health providers, how we can give them the skills to be able to work with families around ALS, because oftentimes those mental health providers are unsure and unwilling because they don't know enough about ALS themselves. So it's about creating that mental health training piece. And again, that partnership with Mental Health America has been really profound. So please know that it's something in the pipeline, but at this point, I do not. That said, very, very happy to, send me an email. We can kind of brainstorm and see ways to find that resource for you.
Thank you. One question, at what age would you recommend children going to the ALS clinic appointment?
Oh, I think I'm gonna take a slight. I'm not sure if I would say an age. I want to be really thoughtful about this, right? Because young children, I have worked with some children who are 8 years old, and they are absolutely emotionally and developmentally ready to have those kinds of conversations and see what's going on. Absolutely. I've also worked with 15 and 16-year-olds that I would never recommend that they go to the clinic, right? So my first response is have that conversation with your child. Let them know what they're going to see, that they're going to see lots of doctors, they're going to see lots of people. So there's going to be like sitting down waiting time, but there's also going to be a lot of really serious conversations happening. So if your child who's younger has that maturity level, then that's fine. If your child that's older doesn't, then that's maybe something to think about. So what I would recommend is that you have the conversation openly several times before you go. The expectations are laid out very clear, and that you are prepared for them maybe getting a little emotional at the clinic, and that you are able to have that conversation with them in the clinic. So I don't mean to make it sound like I'm not giving an answer, but I really want to be careful about saying, oh yes, 10 and above, when sometimes those older kids aren't prepared for it either. So it's really about sitting down and talking to your child and asking them what kinds of questions they have, who they would like to see, what do you think they would get out of it, how do they feel about it. Do a little bit of kind of recon with your child before you decide to bring them to clinic. As a whole, I absolutely think it's a positive opportunity to bring a child to clinic when they are, ready and they have that information before doing it. Yes.
Thank you so much. I don't see any other questions, actually. So I think that the session will be finished. And I really, really thank you. And again, your resources are amazing. And I'm
Oh,
actually
it's
going to write
lovely.
down Mental Health America so I can look them up and
Absolutely.
take note of them, myself.
Yes. Yes.
And
I'm so pleased. I'm so pleased. Thank you. I'm glad the resources are helpful.
yes, for sure, for sure. And I just want to give everyone an update for tomorrow. So thanks everyone for attending today. We hope that we see you tomorrow with the first session starting at 9:30 a.m. The topic is nutrition in ALS. These sessions are being recorded and they will be made viewable next week on both the Hoover platform and on our ALS United Greater New York website and our YouTube channel. We will send out a notification when the recorded sessions are ready to be viewed. We'd like to thank our sponsor, Mitsubishi Tanabe Pharma America, and we'll see you tomorrow. Thank you, Dr. Kavanaugh.
Bye-bye. Thank you. Absolutely. It's my pleasure.
Bye.
Bye-bye. Take care.